Okay, I'll call the meeting to order. It was properly posted on October 20th. And as we're getting ready to do a roll call, we'll note that both the Assessor's Office and District 3 have dramatically stepped up their game. Start with the court clerk.
Rick Warren.
Butch Freeman for Butch Freeman.
Brian Mon.
Carrie Bloomert.
Danny Lambert for David Hooten.
Jim Anderson for Tommy Johnson.
And Rick, do you want to lead us in the pledge?
I would.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Is there a motion to approve the minutes of September 16th?
So moved.
Second.
All in favor, say aye.
Aye.
Any individual consideration on the consent docket? If not, is there a motion to approve?
I'll move to approve our consent docket.
Second.
All in favor, say aye.
Aye.
All right, and then if it's the board's pleasure, we've had a request to do item 37 first, since we have some special guests who need to go on. Mr. Wilkerson, you want to introduce the item?
Good morning. This item is a provider agreement with Lucid Lane, and Lucid Lane is here today to answer any questions that you might have. Just a quick overview. They're powering telehealth to connect with people going through chronic pain, mental health issues, and substance abuse issues like no one in the country are doing right now. They empower it through telehealth. They have unique methods that connect not only with the mind, but also medication therapy and step-down therapy. Since the CEO is here, I'll let him discuss what they do and answer any questions that you might have.
Hi, all. Good morning. Thank you so much for having me here. I'm really honored to be here talking to you all. My name is Adnan Assar. I'm the CEO of Lucid Lane. It's a telehealth company that provides therapy for mental health, for chronic pain, as well as substance use. So these are, providing support to people who have mental health issues with anxiety, depression, chronic pain issues such as back pain, shoulder pain, neck and hip surgery pain, and so forth. And then substance use issues. So, people who are dependent on or addicted to opioids, alcohol, benzodiazepine. So that's what Lucid Lane does. We built a really comprehensive protocol to provide these services through telehealth to people who need this help. We also have a very robust mobile and web application that provides 24/7 remote patient monitoring. So you can actually, have people take assessments and provide us with signals that tells us if they're doing better or not, and then we can essentially escalate them to a 24/7 on-call support team. So we have a team that's available to provide them help on an ongoing basis, not in addition to the scheduled visits that they have with a therapist, and we're monitoring them constantly. And that's a big help because telehealth itself makes things highly accessible for workforce and population that's mobile, as well as population that's in rural areas. Telehealth has become highly acceptable in the health systems and also among the patient population. But in addition to that, we just make it much more comprehensive in terms of providing a 24/7 solution. The benefits are that you'll have reduced absenteeism, more productivity, and lower cost in subsequent years with less ER visits, less hospital visits, less doctor visits, and so forth. So that's the intro to Lucid Lane. Would love to answer any questions you have.
Any questions?
I have, excuse me, I have a couple of questions. I'm looking here at your Exhibit A, which are the rates, and I believe everything, I'm not sure I quite understand. I know everything seems to be $500. That part I picked up pretty fast. Now, and then you list this PM is an all-inclusive price, and then it lists like therapy sessions up to
Yes.
4. So it's $500 per person. And then, and so it gives 24/7 access to on-call counselors,
Yes.
personalized treatment. That $500 lasts for how long for an individual patient?
Yes, that's $500 per member per month, all inclusive, all you can eat. So $500 per member per month includes the therapy sessions, the use of the digital health platforms, the on-call support. So everything is included in that month on a monthly basis.
Okay, per member per month.
Yes.
Does this apply just to the members that use this service, or is, okay, that's just to
Yes.
the members that use the service?
Yes, exactly. Only the members that use the service. So if they
Okay.
contact us and we provide them support in that month, regardless of how many sessions they have or how many times they use a mobile application or web application or how many times they call our 24/7 support, it's a flat $500 per member per month.
And so if they use the service this month, it's 500, and then if they continue to use it next month, how do we determine that who's going to use it?
So essentially, my understanding is that this is going to be advertised to your population, to the lives that you cover, and then we have a 1-800 number, we have an email, so they can reach us and initiate a service to obtain the help that we provide. At the end of the month, we will send you a complete report of how many people we served and send you an invoice based on that. We also have monthly or even weekly population health report so that we can share with you in terms of the population that we're serving, how many people we're serving, how they're trending, what progress they're making, and so forth. So we can share that report with you on a weekly basis or bi-weekly or monthly, whatever you would be suitable.
John, excuse me, John, how does the individual get put with this group?
There's several different ways. The first he addressed is the member referral. The member actually would refer themselves. The second would be their doctor. So
Okay.
they're going to an orthopedic surgeon or they're following up for care. They have chronic pain. Many doctors don't manage chronic pain anymore. They might be left on a medication with no management or a very short-term solution and then left with nothing. They do a deep cognitive behavior therapy as well that actually over time reduces pain through that therapy as well. So they have a unique approach. And just as an added thing that we really didn't delve deep into, but they've done a couple studies, one through Mayo Clinic, or I'm sorry, MD Anderson for their cancer patients for pain, also through Stanford University. And they've seen a drastic improvement compared to patients who didn't go through this program. Over a year, most people's pain went from 75% to below 40%. And then the patients that went through their program versus patients that didn't, over the next several years, their cost avoided up to about $15,000 to $20,000 versus somebody who didn't go through this program, who is just managing it alone or through the regular provider systems. Regular providers are not equipped to manage these type of situations. And that's why we have a need for this, a great need. To put this in perspective, not everyone will use this, but over our whole population, 2,900 people, 1 out of 3 people have taken an opioid, have taken a benzo, or on this type of medication over the past year. So it's 1 out of 3 people are dealing with either chronic pain or brain care issues. So most of our employees are very long-term employees. We address this situation now, get their pain under control, get their situation under control, reduce healthcare costs in the future.
Okay, the therapy sessions, is the therapy sessions person to person, or is it TV to person?
The therapy sessions are person to person.
Okay, so
or
there's somebody
telehealth.
here on the ground with this program. And I'm seeing a no back here.
No, not in person. It's through telehealth.
Okay, that's what
Yes.
I mean, is TV to me.
Yes, exactly. It could be through your computer. It could be through your phone. It could be through through a TV. But we also provide it through just telephone as well, because we recognize a lot of people sometimes do not have access to video conferencing or FaceTime or what have you. So we also provide therapy through just a telephone audio session as well.
Just another point to add, versus a typical provider, they're way more in depth, obviously. But if a member experiences any issues and they're going through treatment currently, they have to make an appointment with their provider, have to wait several days or weeks to get in. With them, they can access them 24/7 and really address the need right there. It's really critical when members are going through that type of situation, they get care pretty much immediately, so it doesn't balloon into something else.
And will this cost the employee, the user, anything out of pocket?
It will not.
Okay.
They've rolled this out nationwide. We'll be the first one in Oklahoma to use it. Other companies nationwide are using it at no cost to employees, and ours, same model.
And you're out of where?
We're based out of California.
California.
San Francisco Bay Area.
Did you come here just to see us?
Yes.
Oh, wow.
This is my third time here in Oklahoma.
Says a lot about California, doesn't it?
Well, I thank you for the presentation that you had several of us attend in Judge Palumbo's courtroom. She was gracious to allow us a social distancing atmosphere for us to come in and hear your presentation. So I found most of that to answer my questions, but are there any others that are here that, and I think the courts are looking at this too. That's correct. I believe so. But to be clear, a budget board member can't refer somebody to this program like I can't refer Butch. He says I'm always a pain in his neck. I was hoping. Okay. Any other questions? Is there a motion?
I'll make a motion.
I'll second.
All in favor, say
What
aye.
was the motion?
To
To approve?
To approve, yes.
Okay. What was the second?
To approve.
Okay.
Can y'all handle him today?
Yeah. Get the words right out of my mouth.
I'll call up the office right now.
2 therapists.
All right. All in favor, say aye.
Aye.
Thank you very much
Thank
for your time
you.
and for coming all
For
that
the
way.
presentation.
Thank you so much. Appreciate it.
Okay, Danny, back to item 33.
All right, good morning. I'll just hit a couple slides this morning. We'll look at the general fund comparison to last year through September. So we're 3 months into this fiscal year. Revenue's up 2.4 million. We expect that because we had budgeted an increase of 4.7 million, about a 5% increase. So that's right on track. We have spent the current budget almost 300,000 more than we did the same time last year. We ended the month with a $10 million cash balance compared to 13 million last year. And then employee benefits. This is just a projection based on the first 3 months. Just take an average, estimate out the rest of the year. This does not include any increase in employee rates that will be discussed later on. So this is what it would look like as budgeted based on first 3 months. Still looks like we'll end the year in a positive 242,000. We've only transferred $1 million to date. There was $1 million that we just approved that will be moved over into this fund. And then eventually we'll get to the full 3.6 million in transfers. So far it's looking good. And then the very next one is looking forward a little bit into October, just the medical and prescription claims. Net paid after you factor in the rebates and the CARES dollars that we've received into the fund, we're down compared to last year about 10%. This is important because this is how we budget this fund. We look back at last year's and base our budget this year based on last year's claims. So everything is looking really good so far. That's all I have. Everybody's speechless. It was.
Okay, any other questions? Is there a motion to approve?
Motion.
Second?
All in favor, say aye.
Aye.
Mr. Cody?
Good morning, everyone. I will try not to rile up the colonel any more than he already is. BET has several items added to the watch list. These are items that were discussed both in budget discussions last spring and then leading up to the September supplement. These were items that were not recommended to be budgeted at the supplement, but we went ahead and wanted to continue discussion and keeping our eye on these items for the rest of the fiscal year. So that's why you see so many on there. Other than that, BET's got recommendations on items 39, 40, and 41, so I'll be happy to answer any questions you have when you get to those items.
Is there a motion to receive his report?
So moved.
Second?
All in favor, say aye.
Aye.
Mr. Wilkerson?
Just a real quick
Just
update.
real quick,
Sorry.
the people who are up here that are not the elected officials are the chief deputies, so you are authorized to make a motion or even second a motion to prove you were here. I sent John over to check the minutes, didn't he?
Not yet. Are we on the health plan update item?
Actuary?
I think there's a health plan update item after the BET item.
Oh.
You're actually 35.
35.
35.
I don't.
There we go. This is just an update from where Danny left off. I just want to make you aware of a couple things on our health plan. As Danny said, we're running about 10% under, $700-something thousand where we were last year, which is a very good thing. A lot of that's due to the COVID reimbursement. To date, since July 1st, we've had $615,000 reimbursed. We paid $1,615,000 worth of COVID claims since July 1st. I just ran a report for the most recent month. We've paid $204,000, so I'll file that for reimbursement. Just be aware that has to go through the BET, the budget board, then the BOCC to get that money put into the fund. So there's some delay after we pay those claims to get it back in. So to date, about $819,000 worth of COVID claims paid since July 1st. Now, the next several weeks, we might see an increase in our check registers, our claim check registers. Make you aware of that. So if you see some high numbers, don't be too concerned. We have about $600,000 worth of COVID claims coming over to be paid in the next several weeks. So those will be a wash because what we'll do is seek reimbursement for those. And that money, about a month later, will be put back into employee benefits. So just make you aware that that COVID relief money is coming, and that's really helping us stay at negative 10% this year.
Okay, is there a motion to receive his report?
Motion to receive.
I have a quick question.
Sure.
So you said since July 1st of 2021,
Mhm.
we've paid $615,000 in COVID expenses. Do you know how much we've paid since the beginning of the pandemic?
We paid $1.9 million last fiscal year. So now with this most recent one, we're on track to be at $819,000 this fiscal year. We have about $600,000 more that are outstanding.
Okay.
So that'd be $1.4 million.
Okay.
Probably next month total.
Okay. Is there a second?
Second?
All in favor, say aye.
Aye.
Are you covering this, Danny?
Actually, Brandon is
Oh,
as the
Brandon,
vice chair
okay.
to the committee.
Sorry, sir.
There's a lot better options on the handbook committee, but this is the best they could come up with today. So this change is simply allows us to modify our current handbook to mimic the state's policy on bereavement leave. It cleans up the language that's currently in the handbook, and further defines when an employee can actually utilize the bereavement leave policy and the triggers that set that into motion. On the attachment, I think there's a track changes form that shows you what the current language is versus what the new language is, and it just modifies it slightly, identifies what the immediate family is defined as, what a household member is defined as, and it changes the language from when in the current handbook it says that in the event that you need to attend the funeral, and it modifies it just to say that you can use bereavement leave in the event of the death of that family member.
Okay. Is there
What was,
a limit to how many times a year it can be used? It's per occurrence, right?
It's per occurrence, yeah.
If you should have the misfortune of multiple in the year,
Yep.
it doesn't restrict you. Okay.
I'm sorry, what drove this?
The state's change. There's
Oh,
a statute,
okay.
and I'm not sure what the statute is, but it requires that we mimic the state's policy on leave exactly. It can't be
think-
more generous than that
yeah,
of the state.
That was the issue. I think ours
Mis-
was a little bit more loosely.
Yeah, Mr. Enderbolson's
Interpreted.
constantly, looking through the state statutes to see what changes are made at the statute level and the policy level, and so that's where it was originated from.
Does an excellent job.
And this is paid leave that someone does not have to use their sick time or their annual time.
Yes, it is.
Okay.
Yep, it's called bereavement leave
Okay.
in the policy.
Is there a motion?
I'll move approval.
I'll second.
All in favor, say aye.
Aye.
We've handled item 37. Thank you.
Good job, you and your group.
Do you want to do this again, John?
We're on 38 now.
38. I've just made a quick overview of the actuarial report. I won't spend much time, but just want to kind of tell you how they develop the rates, what the rates are, and why. They take the claims from the last 3 fiscal years, and that's how they calculate our funding. And what they do is they apply national trends, not our trends, but national trends. And this is a yearly trend. So the yearly trend for medical, they apply 8% increase, prescription 9.5%, 4% for dental, 7.5% for vision, 3% for admin costs. And of course, they calculate that at the end of last fiscal year. So these rates are meant to be placed in the first of the following year. So they have to trend those out a little bit more. Once they trend those out to the first of 2022, it equals 12.2% medical trend, 14% prescription, 6% dental, 11% vision. Overall, if we look at the last 3 fiscal years of the total employee benefits fund, the whole increase is 1.9%. That's the average, or an average increase of $447,000 per year over the last 3 years.
So
So
is that our plan or is
that's our
that?
plan.
Okay, our plan. So you skip now from the universal plan.
Universal plan to ours.
To
Just to
ours.
kind of show you ours over the last 3 years. We're self-funded. It could change minute to minute depending on utilization and who gets sick. But we've been doing really well compared to the national trends, if you can see. Now, I added an additional factor outside the report to cover the employer-paid life insurance and the employer-paid assistance program. That's just a factor we add to the employer side, the premiums. So there's a retiree transfer every month. The employer side for the active employees is transferred through premiums. But every year they said, hey, we should start with a certain balance to cover the retiree employer side, what the employer pays of the retiree cost. It should be, they say, $5.2 million to start the year. Last year we transferred $5.8 million. We had a $1.4 million starting balance. We only used 5.4 of that, and we had 1.8 to roll back to start this fiscal year. So this year we started with that 1.8 million fund balance. We transferred 3.6 million. That's what we're going to transfer total. So we're looking at a $5.4 million total, same as last year. So if we run on trend, the same as last year, we should be fine. And then we have an additional 1.6 million just in case on the watch list. So if we go over what we expect, we have that on the watch list. If we trend the same as last year, it'll be a flat with no increase. Historically, the employee rates, I just put them out there so you'll see them. You know, we've gone up, we've gone down. Last year, we froze them. In 2021, the employee rates to the same as 2020. Then I'll go ahead and show you the increases that they're proposing. And this is just to do maximum funding. Worst case scenario, the plan would be funded. The proposed employee rates have a 20% increase. For single, that'd be $32 a month out of each employee's paycheck that had single coverage, or 19.5% increase for family coverage, $73 per month for each person that had family coverage. Retiree rates, they trend along the same rates as active employees. 12 months of the proposed employee retiree rates would bring in an additional $847,000 into the fund. Now, we're budgeted all the way through this fiscal year, through the end of this fiscal year. We're budgeted to cover the expenses, plus we have the COVID reimbursements that assist with that greatly. So if you implemented the proposed rates for the employees, it'd be half of that $847,000 for this fiscal year, at about $420,000 into the employee benefits fund as a cushion in case we needed it. We don't necessarily need that right now. We're doing fine. The employer rates, of course, we've gradually increased those over time. We didn't freeze those last year like we did the employees. It's about a 6% increase over 6 months, because those are going to go into effect next fiscal year. It'd be an increase of $600,000, about $600,000 going into that fund. And that's just really actuary overview of the report and how they calculate the rates. The next item is to vote on the rates.
Is there a motion to receive his report?
Motion.
Second?
All in favor, say aye.
Aye.
Now,
The rates. The rate item, again, it would be a 20% increase for employees and retirees. The BET reviewed this, and they voted not to increase rates, just to freeze them, since we have enough cash to get through this fiscal year, and the COVID reimbursements are putting extra money into the fund. So any employee rates would just be on top of that, just in case we needed it.
Okay, I'm looking here at one of the reports where it says employee rates. So current, as an example, and I've got so many sheets of paper, I want to be sure I'm looking at the
Sure.
right one. So right now, the single for an active employee is $159 a month, right?
Correct. And here's
Okay.
this right here. Sorry, I'll put that up. Here's a more detailed explanation. It shows the current and then proposed. It goes all the way down through the retirees as well. Because this just doesn't only affect our active employees, it affects about 500 retirees. Because we're really the only governmental entity in Oklahoma that truly subsidizes our retirees.
Now, excuse me, but the BET recommended that we hold them at the current,
Correct.
the 159.
Correct.
Okay. You know, I'm strongly in favor of keeping them at the current rate for a couple of reasons. Number one is the reason that we do so well is because of our employees. And to me, to penalize the employees then because the national rates are going so high, I don't understand that. I don't understand the logic of us doing that to our employees because California, God knows what California does. But anyway, I'm against letting California drive our rates. Our rates should be driven by our people. And if our people can do the things that we're asking them to do, which they clearly are, and keeping our rates down, then why should they be penalized for what happens everywhere else? So I'll tell you right now, I will absolutely be a strong advocate for voting to keep the current rates current, right now where they're at.
it's just an issue of how to pay for it.
The issue of how to pay for it?
Well, I'm just saying, ongoing, we're going to have to pay, right?
Well, currently, we have enough money and we're budgeted all the way through this fiscal year, so that'd be through end of next June.
Right.
So any money that we would take out of the employees' paychecks would just be on top of that money that we already have in there. If we had some extreme cases or experienced a lot more utilization, then we would dip into that fund. But currently, we're not budgeted or don't need that extra money. It would just be on top of what we have.
I'm not worried about that at all.
It's just your seed corn. Just trying to,
I don't mind, if I lose my seed corn, if it's eaten by our employees, then that's okay.
okay.
And then the next item.
Now
would
we
be-
have an acceptable usage for your seed corn. That's good to know.
An approved usage.
And then the next item after this report, if you want to receive this report, would be to vote on the rates.
Okay, is there a motion to receive this report?
Motion.
Second?
All in favor, say aye.
Aye.
Now,
Next item would just be to either freeze or approve the rates.
This is item 39.
Correct.
Okay.
I move that the rates be frozen at their current rates, at their current.
I'll second.
does that need to have an end date on it or just open-ended?
Open-ended until we bring it back.
Okay. There's been a motion and a second. Any other discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? Item 40,
Thank
Mr. Cody.
All right, item 40, John alluded to earlier, this is COVID-related medical expenses that our benefits plan has incurred from August 19th through September 20th to the tune of $288,636.22. The request from employee benefits and the recommendation from BET is to reimburse the plan for those COVID-related expenses from the CARES account.
And Mr. Wilkerson, you said that from July 1 until now, we've spent $615,000 on COVID. Does that not include this number?
The $1,615,000 includes this number.
Okay.
I just ran a most recent report from 9/21 to 10/18.
Okay.
And there's additional 204 requests on top of this that we haven't sent to the BET yet.
Okay.
Okay, any other questions? You want to have a motion?
I'll move to approve.
Second.
All in favor, say aye.
Aye.
41.
All right, 41 is a little bit of management within our CARES account. If you recall, when we first set this account up, we also established a couple of other accounts within it, one for emergency management, one for facilities. The sheriff's office had one as well as juvenile. There's currently $324,249.52 that are unallocated, unencumbered within the emergency management line item in there. And our recommendation is to go ahead and move that at this time back into the 350 account, the general CARES account, so that we can make some assessments on future expenses through the rest of this calendar year. I've had conversations with Mr. Barnes. He's got quite a bit of PPE on hand. He thinks that we'll be fine doing this. And then if something were to occur and we need something else, we also have the ARP money that we can look at PPE expenditures with.
Do you know how much, as of today, do you know how much CARES money we have remaining?
Right around $3 million.
Okay.
Okay. Is there a motion to transfer?
Motion to transfer.
Second?
All in favor, say aye.
Aye.
Any citizens wishing to speak before the budget board? If not, board comments, the undersheriff?
None.
Danny?
No, thank you.
No.
Ladies?
Are you kidding? Thanks to the BET, you all continue to do massive work, and I personally appreciate it, and I'm sure I'm speaking now for every other member of the budget board. We do appreciate the way that you all go through, discuss these items before they come to us. So thank you again, Cody, to you and your entire committee.
Same, and then also I've worked with Jamie on getting the numbers together. We weren't able to get that for this BET, but we'll have that coming up about pay parity for her employees, but brace yourself.
I'd also like to thank Erin for her incredible guidance today.
Such a suck up. Is there any new business? Is there a motion to adjourn?
So moved.
Second?
All in favor, say aye.
Aye.